A quick note before today's episode. While I'm a professor of nursing at the University of Minnesota, this podcast, Midlife Unmasked, is a personal project and separate from my professional responsibilities at the university. This podcast is intended for informational and educational purposes only and should not be considered professional medical advice. Please consult your own healthcare provider before making any decisions related to your health and wellness. In keeping with my role as a nurse researcher and educator, I'm here to bring evidence-based information to improve overall health and well-being. It is my goal to be a trusted source of information and to build this community where we can all learn, grow, and share together. With that said, let's jump into today's conversation. Hey Midlifers, welcome to the Midlife Unmasked podcast. I'm your host, Robin Austin, a nurse researcher and educator, and your guide to navigating everything from healthy aging and wellness to big stuff like caring for aging parents, mastering work-life balance, and discovering your next great adventure. So are you ready? Let's do this. Hey Midlifers, welcome to the Midlife Unmasked podcast. I am your host, Robin Austin, a nurse researcher, health enthusiast, and advocate for living your best life in midlife and beyond. On today's episode, we're going back to the basics. This is a continuation of part 1. We are now into part 2. So we're going to dive into part 2 of Know Your Numbers. And these numbers aren't just stats. They're crucial markers for overall health and wellness, especially in our midlife. From blood pressure to bone density, we're going to break it all down and why each number matters, what's considered healthy, and actionable steps you can take to get these numbers into check. It's always good to kind of level set. Everybody might be coming into this episode with different knowledge, different levels of understanding of our health, but we really wanted, again, to have these first couple episodes as a beginning starting point for everybody to really dive back into some of these numbers just so you have a better understanding of your health and overall health and wellness. So part 2 today is all about performance, longevity, and quality of life. Remember, I'm really interested in health span, meaning the number of years in which you live in good health versus just longevity. So again, we're really about health span here, and we're looking at some of these numbers as a key component to understanding that part for all of us. So on our previous part 1, we covered 5 numbers that were blood pressure, cholesterol, blood sugar, resting heart rate, and waist to hip ratio. Today, we're going to continuing on a little bit more in depth of these numbers. Some of these you have to get tested at specific facilities, and I will talk about that as well. But again, these are just additional numbers that you can have in your bag of tricks or your arsenal to really understanding where you are in your health and your health journey. They're great numbers to also talk to about with your healthcare provider if you do test them and see if there's something might be a little bit off. Again, it's just really great things that you can do on your own for the most part to have a good solid understanding of what your overall picture of health looks like. So today we're going to be talking about heart rate recovery, VO2 max, inflammation markers, bone density, and hearing and vision. Why hearing and vision? Well, I'll get to that in just a little bit, but first we're going to start with heart rate recovery. And why does our heart rate recovery matter? It's again one of those markers for cardiovascular fitness that can tell a lot about our health span and potentially identifying things very early of maybe some things you might need to get checked out or to watch for as well to give you a very solid baseline of where you are. So why heart rate recovery matters? It's the ability for your strong heart to bounce back quickly after exercise. So again, it's the ability for your heart to bounce back after you've been strenuously exercising. And the faster your heart rate drops in the first minute or 2 of post-exercise, the better your cardiovascular health. So how we check it is that after intense exercise, you're going to go for a vigorous walk. Maybe you're exercising on a bike. Maybe you are on a row machine, or you're going for a jog outside, whatever it might be. You're going to do your intense exercise, and you're going to right when you stop, you're still huffing and puffing. You're going to take your heart rate, whether that's on your wrist, again, your radial blood pressure, again, right by your thumb, or on your neck, which is right next to the carotid artery on the side of your neck. And you're going to use your index finger and your middle finger to take the heart rate that you have. So you're going to take that, still huffing and puffing. You're going to take it for about a minute, or you could do 30 seconds and then multiply it by 2. But again, you're going to get that number. So that's your heart rate right after you're done exercising. Then you're going to cool down for about a minute or 2, but nothing more than that. And then you're going to retake that heart rate again. So you're going to, right after you're done exercising, cool down, get a drink of water, another minute or so, and you're going to take it again. Then you're going to take the first number and the second number, and you're going to subtract them. And that is your heart rate recovery. So a drop of about 15 beats per minute is ideal. Again, it's 15 beats per minute, which is that heart rate recovery zone. Again, there's all varying abilities within that range, but that's really kind of is our target. If for some reason you are much faster than that, then congratulations, you're in fantastic shape. But if you're a little bit lower than that, then we might want to take a look at what that heart rate recovery is telling you. And you may want to bring that number into your provider when you do go in for your annual appointment. But again, it's really a measure of how good a shape your cardiovascular system is. That is heart rate recovery. Next, another marker that we're going to talk about is VO2 max. V stands for volume. O2 is the chemical symbol for oxygen, or O as in open, and then the number 2. And max signifies maximum. So your VO2 max is a marker for cardiorespiratory fitness. Again, one of those other key markers around how strong your cardiovascular system is. Improving this number means better oxygen utilization, which translates to better stamina and overall health. There's new research coming out specifically around VO2 max and keeping that as high as we can as we age. It's a really strong indicator for, as we said, cardiovascular fitness, but also health span, trying to keep you in the best shape as possible for as long as possible. So VO2 max, again, is a key metric. Understanding your cardiovascular fitness, it shows how efficiently your body can deliver and use oxygen during physical activity. And so if you're into sports or fitness, you may have heard VO2 max before. If this is new for you, it really is about the best indicator for cardiovascular fitness and aerobic endurance. So why is this important? So VO2 max measures how much oxygen your body can consume during exercise. Oxygen is the key to life. So as a result, it will provide a really strong indicator for an individual's overall fitness level. Research has shown that individuals with higher maximal oxygen tend to have, by definition, higher levels of fitness. And there's a huge relationship between fitness and a whole host of other health-related outcomes. Really understanding where you might be in the range of where your VO2 max is can be a good indicator of where your current cardiovascular fitness is. And if it's a little bit lower, then we need to make sure we're trying to do some things around exercising to get that a little bit higher. And it's a strong predictor for a longer lifespan and also a true indicator, I think, of health span. It's really quite exciting, the new research that's coming out. So how do we test this? There are some, I think, equations you can kind of estimate out there, but a real true measure of VO2 max is going to take place in an exercise lab or a specialty fitness center if they have equipment to do that. This test requires you to wear a max while you run or ride a bike or use a rowing machine, and with exercise that's intensely, gradually increasing. I did this test when I was in undergrad. We had a performance testing center where I went to school, and you wear a mask and they put you on a treadmill and it keeps getting higher and higher and higher till you literally cannot do it anymore. But it's a simpler alternative. You can test this using some trackers, but again, it's an estimate. It doesn't provide like a true potential indicator. I would say the best way to get it done is to do some professional testing. It probably is not covered by insurance, however, but it would really give you a strong indication of where you are. And it could be used as a motivational tool to have you do some other exercises to try to boost that VO2 max. You can literally Google VO2 max testing in your area. Again, it would be an exercise lab or a specialty fitness center. You could talk to your provider if they have cardiac rehab where you are in your specific health system. Maybe they offer it for public without a referral. I don't know, but it's something to check out. Otherwise, sometimes universities have a performance lab and they do offer some public testing as well. Again, just a suggestion. I don't know for a fact, but it's something to try to examine out or see in your area. There are more specialty, I would say, pay-for-services exercise labs popping up here and there. Again, it depends on how big your city is, things like that, but just something to look at if you're truly interested in having it tested in a lab-type setting. So how do we start our smart strategies to increase our VO2 max? The best way to boost your VO2 max is to incorporate some what we call high-intensity interval training, or HIIT, HIIT. These really occur for brief intervals of intense exercise followed by shorter recovery. Again, if you're new to exercise or new to high intensity interval training, please get some other additional testing done first. These are just suggestions, but I want to make sure that that type of exercise is okay for you to do based on where you are right now in your health journey. That's one example of how to boost your VO2 max, but it's really cool, I think, indicator of where you currently are for your health. Our next number, the third we're going to talk about, is inflammation and inflammation markers. So specifically, what you've probably heard about in the news or the media is that chronic inflammation can really be a silent driver of many of our chronic diseases that we have, that we see today, such as arthritis, heart disease, even cancer. Inflammation can sometimes present itself as joint pain, but really chronic inflammation in our bodies is really wreaking havoc over time and really a silent driver of many of the diseases that we see. So this marker is a bit harder to quantify, but if you have too much inflammation, it may be showing up in your body as redness, swelling, again, painful joints, but it's also other indicators of some skin disorders that you might be seeing, chronic bloating. It's hard to see inflammation per se. So again, this is something that we really want to make sure we have a lab test for. And the way they test typical inflammation is called C-reactive protein, or CRP for short. And this is again done by a blood test. And so you might want to ask your provider when you go in for your annual physical, which all of you are going to now do, or if you just went in, you missed something, you might want to check in to see if they could also just order and you walk into your lab and do it. But again, C-reactive protein is a key marker of inflammation in the body. And you want a lower number than a higher number, but it's a simple blood test. And elevated CRPs can indicate chronic inflammation. And again, this is linked to many conditions such as heart disease, arthritis, again, even cancers. It's a really strong indicator of what is going on within your body, or what we also call systemically. So it's not just one part, not just one joint, but it's happening all over the body. And there are ways that we can reduce inflammation in your body and bring down that CRP number if it is potentially high. And that you can do through anti-inflammatory foods such as fatty fish, turmeric, green leafy vegetables, eating a diet that's lower in food additives and some of the non-real food that we eat so much in our diet. Eliminating some of that sugar is a chronic inflammatory component as well. But really trying to make sure that just to see where we are within our inflammation within your body. If you already are low, fantastic. That's great. But if you might be on the higher side, greater than 3 milligrams per liter, when you do have it tested, is a higher number. There are ways that we can continually bring that back down. Again, exercise is a great way to bring your overall inflammation down. Stress management, and also sleep are other components, really trying to link a lot of research with inflammation and poor sleep. So again, that overall kind of holistic picture of what we think of for our health, the main components: sleep, exercise, hydration, water is a big component, and eating a healthy diet based on whole foods versus all the foods that have the processed components and higher sugar and higher fat content. So again, C-reactive protein is another one to really keep an eye on for overall kind of looking at things holistically for overall health. The fourth one we're going to talk about is bone density. And it may not be something that you thought of for health span or longevity. It's not one of the ones I don't think is brought up enough potentially, just now that we know what we know, kind of the more research that's coming out, specifically bone density, especially for women. They're at a higher risk of developing osteoporosis due to hormonal changes, specifically during menopause. Osteoporosis is a condition where the bones become very weak and brittle, making them much more prone to fractures. So why is this important? Is that because knowing your bone density can really provide you with some good information of specific preventative measures that we can take to increase our bone strength, also to maintain our muscle mass so we have better balance, so we're not going to be higher risk of falling. Midlife is a critical window for bone health, but specifically for women as we go through menopause. Peak bone mass for women in general typically reaches in our 20s and late 30s or early 30s, and making midlife really that critical window for protecting and preserving our bone health. So it's a key to understanding that bone loss is highest at menopause. Typically an average of bone loss around 2% beginning at every 1 to 3 years before menopause and lasting 5 to 10 years. So sometimes women can lose maybe 10 to 20% of their bone density after they go through menopause, which is astronomical. I knew it, but I didn't know it. So when you start to see some of these numbers, it's really critical. Midlife is a critical window for women in bone density, maintaining our muscle mass. I'll probably talk about this more in detail in future episodes just because I'm so passionate about it. But it's really one of those main health components that we can really take advantage of and do some serious preventative measures for. Other kind of influencers around women's health talk about the fact that I'm not just doing it for vanity reasons to maintain my strength, but it's also to keep us out of long-term care facilities or to have a fall where we risk breaking our hip or a bone where we're then having some long-term ramifications of some of those components. But really considering, again, it's imperative around our bone health. If you're not talking about it with your provider, talk about it with your friends, talk about it with other people, but you have to be bringing it up with your health provider as well. Another staggering statistics that I wanted to talk about is that women that are postmenopausal, 40 to 45% will have as a risk fracture in their lifetime related to osteoporosis. So it's a huge, almost half of us will come across and unfortunately have a fracture related to osteoporosis in our lifetime. And unfortunately, hip fractures are associated with a 5 to 8-fold increase in mortality within the first 3 months after a fracture. I'm going to say that again. Hip fractures are associated with a 5 to 8-fold increase of mortality within the first 3 months after a fracture. So it's hugely imperative that we really try our best to increase our balance, increase our bone density, maintaining our muscle mass that we do lose as we age. And I'm going to do a whole episode on just skeletal muscle components and longevity and health span because I think it's so important. And also after a hip fracture, unfortunately, women might require long-term care. And at least 50% are going to have some long-term loss of mobility. I don't want to be doom and gloom, but I really want to be imperative how important it is that we are doing some strength training, that we're doing resistance training, that we're really trying to very cognizantly to maintaining our muscle mass and our bone strength. So those are just some of the risk factors. But again, bone density is a huge component. The number one test that we do for a bone density is your DEXA scan, which is a test that they will do, kind of a gold standard of understanding where your current bone density score is. And it will give you a risk score to maybe potentially how likely it is that you might have a fracture in your future. But there are things that we can do preventatively. It'd be very important to talk to your provider or your health clinician about getting a bone density scan. And you're understanding they can calculate your risk of that based on some genetic factors, based on other factors if you've had a fracture in your past. But it's really good to start talking about that and having a preventative picture of what you're going to do to help take care of that. So I can't stress it enough. Understanding maybe potentially getting a DEXA scan, which is that gold standard recommended for men and women over age 50. If you're at higher risk, maybe they would do one earlier for you. But again, bone density is a critical component to having health span. And the last two that we're going to talk about today is hearing and vision. It might be kind of silly that I'm bringing it up, but at the same time, I think it's not too early to also make sure you're getting your annual exams for your eyes and also your hearing. It's not the coolest thing to do, but I always think of getting your hearing tested as, oh, I can't believe I'm midlife and I'm actually having to get my hearing tested. But it's really also an indicator and giving you a baseline for future things if something were to come up later on. And they're also linking the hearing to being able to, for not only safety features, but also the risk of being socially isolated, not hearing very well if you're in crowds or you're in an environment. And over time, a decreasing hearing can also be somewhat isolating. I don't think that we probably talk about it. We're midlife. I still think of myself as 22. But however, hearing can be a thing to really make sure that we're paying attention to and at least getting a baseline of understanding of where you are, just to understanding your tone decibels, things like that. And also, again, if there's ever a significant change in your hearing, that you'd want to know that as well. But also the other component is vision. And maybe you're needing readers, maybe you already have glasses or been having them for quite a while. But I think vision is another one of those things that we tend to overlook. Sometimes you're so busy in midlife, I get it. It's hard enough to get in for your annual appointment every year, let alone going in for a vision test. But really having, again, that baseline of your vision and your eye exam, it's really recommended that you have your eye exam every 1 to 2 years at a minimum. As we age, you can have vision changes that come on rather quickly. And you want to make sure that you have a baseline of where you are now with no changes. So if something does happen in the future, they can get on it and act on it right away to prevent any serious damage potentially to your vision. As we age in midlife, we need our vision to be as well as we can be. But if you're experiencing any sort of sudden eye pain, double vision changes, blurriness, you get the floaties potentially, those are all things to really make sure you're watching and go in for just that, again, that eye exam. It can't be strongly enough recommended. It also, some of your vision changes may depend on your genetics, particularly a family history of anything like a glaucoma, if there's a family history of diabetes or macular degeneration. Those are things that you're going to want to note in your history, and to really making sure that eye health is a critical component of maintaining our midlife health and beyond. And vision changes can really come around specifically during this time period. And so really making sure that we are on top of that and staying with that. Any changes that you do have, you're able to go in and catch right away. So again, it's hearing and vision. Again, not something that's probably the most coolest kind of idea, but again, we are at midlife, again, just to try to maintain our health as best as we can. And that does include hearing and vision to be in our tip-top shape as best that we can for our health. So there you have it. That is part 2 of Know Your Numbers. Again, 5 numbers that we talked about today was our heart rate recovery, VO2 max, inflammation, bone density, and hearing and vision. So these are, again, numbers that you're going to want to have for your overall health and well-being. And this, again, is part 2 of our series on Know Your Numbers as a way to get everybody included on understanding their health journey and where they are today. Can really help you for that health span that we'll talk about in future episodes as well. So I really thank you for taking your time to meet with us today and to share this time and to plan your health. So again, if you have any other episode ideas, please let us know. We'd love to hear from you. I highly encourage you to seek out a provider, and one that you can see at least once a year. I can't stress that enough, particularly as we start off having this midlife journey. In future episodes, we'll cover other things with annual exams, and we'll also try to identify all these values for your own health and living what's in your control within your own health and understanding the best that you possibly can. If you enjoyed this episode, please don't forget to subscribe and share it with a friend or leave a review. Until next time, take care of yourself and keep unmasking your best midlife health. Thank you so much. That's a wrap on this episode of Midlife Unmasked. I hope you found inspiration and a few key takeaways. If today's episode resonated with you, please be sure to share it with someone else that could also benefit. And don't forget, this podcast is here for you. If you have a topic or a question you'd like us to explore, please send it our way. Your feedback helps us reach even more listeners on this shared journey. You can find us on social media and our website, midlife-unmasked.com. That's midlife-unmasked.com. And the links are also in our show notes. Until next time, keep unmasking your potential, embracing the possibilities, and living your best midlife with courage and confidence. Take care and see you next week.